I decided to have this live session today so that I could speak with just you here on YouTube. Now I know we have somebody here that can hear me. Good evening. How are you doing? Who is here? Who do we have online? Good evening. Welcome. I see you. I see you. How have you been? If you can hear me, say yes, I can hear you. Yes. So today we are taking some questions and answer, and I just hope I can respond to every one of you tonight on the platform. So if you have any questions, please feel free to drop your questions here, and I'll do my best to respond to you. Yes, yes. Should I try that? Hi, good evening. How are you? Can you hear me? If you can hear me, just say yes, I can hear you. So let's talk. My name is Dr. Frederick. You know, I always tell you good life in a sense. Yes. Um, so let's discuss. I don't want to have a full house. I just want to have a limited number of people online today, and then we discuss, we interact. Godson Unwachuku. Yes, I can hear you. Thank you very much. I see your comment, Godson. Yes, I see you. I see you. I see you. I see you. Okay, who else do we have here? Who else do we have online? We're going to spend just 30 minutes. Nasuvandi. Okay, Nasuvandi is online. Okay, yes, I can hear you. Nasuvandi can hear me. Who else again do we have here? So if you have any questions, please drop your questions, and then let's go. Nasu is here. Godson is here. And who else again? Emmanuel Mutu, how are you, Emmanuel? Good evening, Emmanuel. Good evening. Emmanuel Mutu is online. Nasuvandi is here. Godson is here. Okay, we have 5 people online. Okay, why is this camera like this? Why is this one acting like this now? Hmm? Okay, for the guys on TikTok, good evening. How are you? Good evening. Good evening. Let's go. Okay. Yes, Ruth, good evening. Ruth, how are you? Make Jesus know in the world. I see you. Good evening. Caroline Idahosa, thank you, my doctor. Caroline, good evening. I see you. I masticated. You are welcome. So please ask me your questions tonight. Let's interact. Let's talk. I'm not on Facebook today. I just want to be here on this platform. Ice, how far? Ice, how far? How you day? Somebody's already inviting me. Ogedegbe God's love. How are you? I'm currently on YouTube live. Ogedegbe, good evening. I'm on YouTube live. So you can join me on my YouTube and drop your questions on YouTube. Yes, my YouTube handle is Dr. Fredo Star. Destiny, good evening. Keishon, good evening. ZL, good evening. Naira Captain, good evening. What do I do? I don't last as a man on my woman. Please, what do you think I can do to salvage that? Okay, so when you say you don't last as a man, how long do you last? Because not lasting is relative, or we call it relative. When you say you are not lasting as a man, what do you mean by you are not lasting? Good evening, Khadija. Good evening. How many minutes do you last? Some people will stay 10 minutes, 15, 20, 30, 7, 5, depending. So, my brother, how long are you lasting? And you want to last longer than that? Good evening to those on TikTok. How are you? I think I need to change. Why is this thing appearing somehow? Why is this lens appearing somehow? Okay, be fine. Yes. So talk to me. How long are you lasting? And let me know. Good evening. Good evening, Jacinta. How long? Let's see your comments. We have 7 people online on YouTube. I'm currently live on my YouTube channel, Dr. Fredo Star on YouTube. So you can join me on YouTube and drop your comments. I'll be able to take your comments. 30 minutes. Who says you should last on a woman for 30 minutes? Jesus is Lord. Hi. You can come over to YouTube. Oh, I'm attending to a comment on YouTube. 30 minutes. There is nowhere it is written that you must last 30 minutes on a woman. The normal time is about 5, I think 5 to 10 minutes. There's an average of 7 minutes. For some people, 5. For some people, 7 minutes. So nobody says you should last 30 minutes on a woman. Do you understand? As long as you and your partner, you are okay with it. Case closed. Bro, just 5 minutes, and sometimes I avoid her because of my condition. Okay, my brother. You have questions on kidney stone. Drop your questions on YouTube. So you last 5 minutes. Now, this is how it is. The first round, the first session, the first episode would always be short. 5 minutes, no problem. When you go again, the second round, it's going to be longer than the first round. That's number one. Number two, if you don't engage in these acts every time, you're always avoiding your partner. There's a very high tendency that every time you go back, you would not perform up to 5 minutes or yes, 5 minutes. But it's important you know that for some men, 5 minutes is okay. Oh, my brother, there is nowhere that it is written that you must stay on a woman 10, 15, 20. But what you can also do is that you can adopt the foreplay. You can try foreplay before you start the main business. With that, you can buy time. Princess Stephanie, how are you? Fearless with something. Don't take any medication to last long on a woman. Yes. So I'm on YouTube live. I'm on YouTube. So go to YouTube and search for Dr. Fredo Star. Doctor, please, what dietary advice will you give for patients with type 2 diabetes for weight loss? Why do you want? I don't understand. Weight loss. Exercise, my dear. I hope you are on your medication. You have your doctor's prescription with you. So type 2 diabetics should be on their medication. Your exercise is very, very important. And then nobody says you should lose weight. Exercise would help you also control your blood sugar. Yeah, very important. And then eat your food in moderation. You can eat almost anything, but let it be in moderation. Those on TikTok, nobody is sharing my life. People are not power tapping. No, nothing. Some guys are taking pill to last a long time. Very bad. Young men are destroying their lives. Young men are destroying themselves because they want to impress ladies. So they buy medication to drink, and when they take it, they begin to perform 30 minutes, 45 minutes. My dear, you will die before your time. Yeah, it's a very bad habit, and so many untimely deaths. What can someone use to unblock a fallopian tube? You cannot use anything. You have to go to the hospital and see a gynecologist. Please, doctor, I want to carry my baby in IVF. Please tell me something. You want to go for IVF, Caroline? So Caroline on YouTube is asking me a question, and she says that she wants a baby via IVF, right? It's possible. So my advice would be for you to look for centers that can do this for you. I don't know where you are. If you are in Nigeria, if you're in Lagos, there are centers in Lagos that can do this for you with good results. Though I don't have any personal relationship or connection with them, but it's possible. So IVF, they will take your egg and take the sperm of your partner, they fertilize it, and then they put the egg inside of you. IVF is called in vitro fertilization. Do you understand? Yep. Okay, how are you? I'm doing very well. So join me on YouTube. And ask your questions on YouTube so I can see your comments on YouTube. Somebody says, I have a question about kidney stone. Please ask your question on kidney stone. Go ahead, go ahead. Ask your questions on kidney stone quickly. Ask your questions on kidney stone quickly. Let's go, let's go. Those I'm currently live on on YouTube and TikTok. Okay, good. Let's see. Share the live stream and power tap. Keep tapping, keep tapping. Don't forget to send roses. You can send me rose on TikTok. Caroline Idausa, are you here? Oh yeah, now I'm waiting for your comments. Okay. Who else again? So it's a bad habit. If you have a partner, huh? You're in a relationship, you are married, you have a partner, a guy, a male partner. This is for the guys now, and they are taking substances, so that they can last long on the woman. It is a very bad habit. We don't encourage it, except prescribed for you by your doctor. Please don't take any pill to enhance your sexual performance. You have to speak with your doctor. Very, very important. Okay, I'm waiting for your questions. Let's see. Okay, thank you. Sorry, I'm seeing comments here. Emmanuel say thank you. Caroline, I had kidney stone in 2020, which was removed by surgery. But right now, I have been having chronic pain for over 6 months. And yesterday, through scan, it was found that I have stones on both kidneys. That's what now? Jesus is Lord. That's what? That's what? I can't see the other parts of your comments. Caroline, okay, very clear. Please, I am not in Nigeria, but I would like to have your number. Okay, how can I prevent the occurrence? I'm scheduled for surgery already, but I don't want to ever go through this again. Jesus is Lord. I'm so sorry you have a recurring kidney stone. I'm so sorry, but I think that your doctors actually are in the best position to advise you. And what I will tell you to do is that they are the best. And I also want to believe that you are seeing a neurologist, right? A urologist. Thank you for the gift. A urologist. Thank you so much. So you don't have to be scared. Please, you should stick with your urological advice if they want you to go for the surgery. But why surgery, by the way? There's another procedure. Shockwave lithotripsy is a procedure whereby they break the stones. You understand? Unless your stones are very big. But there are procedures whereby they use shock waves to break down the stones. Yeah. And then there might be a medical condition that is causing you to have recurring stones. So let them tell you what is going on. Yeah, 8 millimeters. Wow. And you said it's on both sides, so they should be helping you, please. They should explain to you why you are having recurring kidney stones. Maybe it's your lifestyle, maybe it's genetic. You understand? Yeah. Happy new month, everybody. Welcome. Happy new month. I am not in Nigeria, but I would like to have your number. Ogedegbe got love. Mayowa wants my number. Mayowa, I'm sorry. I don't give out my number. I'm sorry. Because if I give out my number, everybody begins to call me. I don't have a private time. So I don't give out my number on social media. But the only thing I do online is I do online consultations, because people want to speak to you, people want to speak with you. So I can't say I'm not going to speak with you if you book for a consultation. You get? So there is a link on my page on all my social media platforms, on YouTube, Facebook, TikTok, Instagram, Twitter. Yes, there's a link on my page. Please click on the link and book for a consultation. I beg you. You would have to pay for it, because if I start giving everybody access to me, my dear, my life will be useless now. So no vex, I beg. Yeah. Thank you for understanding. Yes, so I have some questions on TikTok. Let's take some questions on TikTok. Let's see. Somebody says, you're always having headache. Why? Always having headache is not right. It's not okay. You should be finding out why. Your lifestyle, the kind of job you do, metabolic disorders. So, recurrent headache, persistent headache is not something you should be joking with. You understand? Let your doctor examine you. I don't want to come online and mention some medical conditions here and you begin to say this doctor is calling bad problem for me. I don't want to say you have this disorder, you have this problem. But if you're always having headache, is it that you are not sleeping well? Is it that you have elevated blood pressure? Is it that you have space occupying lesion? There are many things that can cause persistent headaches, you understand, that needs to be investigated, examined and investigated. I beg. Yes, thank you very much, Ogedegbe. Thank you for your understanding. Where is that man that said you can't speak English? You should come. Oh my God. Oh God. Peace. How are you? So guys, I'm live on YouTube and I'm live on TikTok. Does getting exercise relieve back pain? It depends, my dear. No name. It depends. It depends on the cause and the type of back pain you have. It depends on the type of back pain. There are certain exercises you can do that will help your back. Yeah, exercises that can help you strengthen your back muscles. But if you have degenerative problems, if you have spine disorders, exercise might worsen your problem. So you have to be sure of the cause of your back pain and the diagnosis so that you don't give yourself more problems. You understand? Yeah. Okay, please keep dropping your comments on YouTube. I'm live on YouTube, ladies and gentlemen, so you can move over to YouTube and drop your comments on YouTube, please, so that I can see it clearly. Okay, thank you, you're welcome. Doc, I just did HSG test now. I'm still feeling pains at home. What can I take? HSG. So HSG, sometimes HSG can give you little pain, you understand, because of the procedure. Can give you little pain because of the contrast, you understand, can give you little pain. Well, I believe they advised you. There are some things they will tell you to note. Yes, so take note of those stuff that you were told. You can take your analgesics. You can take your analgesics to help you relieve the pain. Stella Maris, how are you? Yes, he is. Good evening. Oh my God. Peace, how are you? Please, do you know if bitter leaf has oxalates? No. I don't know about that. You are asking me because of your stone, Abi, your kidney stone. My brother, if you have kidney stone, bitter leaf will not dissolve your stones. Bitter leaf will not dissolve the stone. If it would, we would have had that findings a long time ago. But I doubt if bitter leaf would dissolve your stones, your oxalates. You understand? Yes, I doubt. Is it okay to visit a chiropractor for spinal alignment? I'm not going to advise you to do that, madam. I'm not going to advise. I'm saying I'm not going to advise you. You know, on the social media, you can be dragged for a silly mistake. So I'm not going to advise you to do that. If you have a spinal misalignment, rather you should be seeing a spine surgeon. I beg. It's been long. I heard you mention human papilloma virus. I think I have a video on human papilloma virus. I'll be editing that video very soon, though. Yeah, HPV. Thank you for reminding me on the HPV. So if you are a lady here, you are listening to me, and you haven't gotten yourself screened for HPV, cervical cancer, I want to appeal to you. Please get yourself screened, get yourself tested. I beg you. So if you know you are listening to me and you have engaged in intercourse, you don't dey knack, you dey do genital collision, it's important you get yourself screened for cervical cancer, cervical or cervical cancer, cervical cancer, HPV. Please get yourself screened. Why? HPV causes cervical cancer, and it can be managed if detected early. It can be treated if detected early. Yeah, you're a good PA. Omo, how are you? Pretty. So comment on YouTube. I'm on YouTube live, so you can ask me your questions on my YouTube page. Please go to YouTube, search for Dr. Fredo Star. Sometimes I ask myself, I'm fertile, because since I've been meeting with my woman, going to a year now, she hasn't told me any time that she's pregnant or missed her period. What can I do? So Emmanuel, you can actually be fertile, but what is happening is that you might be missing her ovulation. Listen, my guy, you can engage in intercourse, but if you miss that particular time that she ovulates, she won't get pregnant. Oh, you might be shooting all the goals, shooting all the shots, but no one is going into the goalpost because you are actually not shooting it at the right time. That is number one. Number two, if you feel that you have a problem, you can do a seminal fluid analysis for you. Yeah, I think so. But most importantly, your partner needs to know her ovulation period. You need to meet your partner during her ovulation period. If you knock your partner, your woman, during ovulation, she will carry belly now. Hmm? Doc, why are you not on live on Facebook? Yes, I just want to be on live on YouTube tonight. So I'm live on YouTube today. Maybe tomorrow I will go back to Facebook. Yeah, yes, I will go back to Facebook. But today I just want to dedicate this live session to my Facebook subscribers. I really want to give more time to my Facebook subscribers. So I told them on Facebook that I'll be live on YouTube tonight. So if you are on TikTok listening to me and you want to ask me any question, you can also join me on my YouTube, Dr. Fredo Star on YouTube, and ask your questions. Yes. Welcome. Peace. How are you? What causes HPV? HPV is a virus. HPV is a virus, the human papilloma virus. This virus, there are many types of this virus, so many types. This virus causes cervical cancer, vaginal cancer, penile cancer or penile cancer, even esophageal cancer. This virus can be gotten through intercourse. This virus can be gotten through sexual intercourse. So if you have genital collision, vaginal intercourse, anal, oral, you can get the virus. Somebody says, can I invite you to my show if you don't mind? Prestigious talk show. It would be an honor to join your talk show. It would be an honor. Please do me a favor. You can send me a message on my Instagram page, please. You can send me a message on my Instagram page. Inbox me on Instagram, the same handle on TikTok, Instagram, Facebook, Dr. Fredo Star. Please do so. Tell me more about the show, and then I will do my best to be there. Yeah. Thank you. What are the symptoms of HPV, the human papilloma virus? Dependent. So this is how it is. Most times your immune system can actually suppress this virus. Your immune system can, in some cases, suppress the virus. But when you have a weakened immune system, this virus can cause problems. So let's start with the cervical cancer. At the very early stage for ladies, you can have problems with vaginal discharge, bleeding after intercourse, lower abdominal pain, and what again? Smelly discharge. Most likely, those are like the early symptoms. Now, for some ladies, whenever they have these symptoms, what they do is that they begin to self-medicate. They self-medicate, which is very bad. So we advise you to get yourself tested and screened, especially if you are sexually active. Very, very important. Yes. For those on YouTube, I'm waiting for your comments. I'm waiting for your comments on YouTube. Let's go. No more comments on YouTube. Please ask me your questions. Internal injury, but after 2 weeks, things later look strange to me and I'm not comfortable. I don't understand what you mean by internal injury, my dear. If you have not subscribed to my YouTube channel, please, why? Everybody listening to me on TikTok, why haven't you subscribed to my YouTube channel? Why haven't you subscribed to my YouTube channel, ladies and gentlemen? I wrote before that one. Please check. No, I didn't say it, my dear. I'm not seeing it on my screen. I'm not seeing it on my screen. So you would have to come to YouTube and drop your comments again. I can't see your comments on TikTok. Come to YouTube and send your comments on YouTube, please. Now, this is a disclaimer, ladies and gentlemen. For those that are coming to my page for the very first time, please, I beg you, I don't prescribe on social media. I don't prescribe, I don't manage on social media. So in case you are here and you are looking for medications, please, I beg you, I don't prescribe, I don't treat on social media. So in case you have maybe infection, you have high blood pressure or the rest, I can never ever prescribe any medication for you. The best thing I'm going to do for you is that I will advise you to please go speak with your doctor. Do you understand? We don't manage on social media, I beg. The only thing I could prescribe for you would be your analgesics with advice, would be maybe your multivitamins or multivitamins. In some cases, supplements. Yes, these are the stuffs I can, in certain cases, prescribe for you. But if you are looking for certain medications that you must get from your doctor, please, I can't. Yeah. Yes. Ovion, how are you? So please, for those who are not following me on YouTube, why are you not following me on YouTube? Remember, everybody, good life. Now waiting, good life now sense. Thank you for the roses. Thank you for the gifts. How to get pregnant with PCOS, that is polycystic ovarian syndrome. So I have made videos on PCOS. It's on YouTube, it's on Instagram, it's on Facebook. I don't know if it's on TikTok. You can watch the video. You would have to go discuss with a gynecologist if you have PCOS. PCOS can only be managed by a gynecologist, and if properly managed, you can get pregnant, madam. Somebody's asking me, okay, the doctor, thanks for your good work. Yeah, Godson, thank you. Some people are joining me on YouTube. Yes, I see you. Welcome. Subscribe to my YouTube channel, guys. Everybody listening to me on TikTok. Yes. Does HPV also affect men? Yes, sir. The HPV also affects men. It can give the man can develop what we call penile cancer. That is cancer of the blockers. Yeah. Can give you cancer of the throat. Anal cancers too. That is why we advise that ladies get tested, and then for the men above the age of 25, you can't really get the vaccine again. We advise that girls and boys receive the vaccine from the age of 9 years. Parents, give your words the vaccine, Cevarex vaccine and Gardasil. I have knocked her on her ovulation and it seems not working. All of these worries me. I really want to know if this is my fault. She's not getting pregnant. Please help me on what to do. So Emmanuel, if you and your partner have been trying to get pregnant for over a year right now, I think that the two of you should go see a doctor. Go see a gynecologist. Very important. They would test you and they will also test your partner. Very, very important. So relax your mind. If you have been trying for more than a year, now if you have not gotten up to a year, at least 3 times in a week you're supposed to knock. If you are trying to get pregnant, you're supposed to knock at least 3 times in a week. without protection, without CD, without any form of contraception. Please, doctor, what are the blood group that can't marry each other? You can marry each other irrespective of your blood group. The only issue is your genotype. Genotype. AS and AS should not get married. AS and AS are advised not to get married. Advised. AS genotype and AS hemoglobin genotype are advised not to get married. AS and SS are also advised not to get married. Not to get married. But if you are financially buoyant, I repeat again, if you are financially buoyant and you insist on getting married, you should understand that there's a place for testing. Yes. What we call, what's the name again? My brain. Prenatal genotype diagnosis. So that when you are pregnant, you can carry out the genotype test of the baby while you are pregnant, or you can carry out IVF. So during the IVF process, they can select this genotype and this genotype. You understand? Yes. But if you know that you are not financially buoyant, you are struggling to eat 3 square meal, sakpasi they disturb you and your partner, don't try it. Don't try it. Yeah. What are the symptoms of ulcer? Go to my YouTube page, Gold. I made a video on ulcer. Go and watch the video on YouTube, yeah? Please go to my YouTube page. Go and watch the video on ulcer. Go and watch the video on ulcer. It's on YouTube. It's on YouTube. It's on YouTube. Go to YouTube and search for Dr. Fredo Star. Yes, cancer of the blockers. The doctor, how can I maintain a good eyesight? I have a very good sight and would want to maintain it. What should I be doing to keep it up? Number one, I don't know what you mean by good eyesight. The only time you can say you have a good eyesight is when you get your eyes checked. So the first thing I'm going to tell you is get your eyes checked, number one, first. Number two, ensure that you use sunscreens. Sunscreens, you get? When going out in the sun, use sunscreens. Number three, don't spend long hours looking at the screen. Your TV sets, your phone, your laptop, your devices, don't spend too long looking at them. Give a reasonable distance. You can also use what we call the photochromic lens to help reduce the amount of rays going to your eyes. And then eat fruits and vegetables. Very good for you. Vaccine wey dey this life plenty. Yes. So hi doc, a friend of mine was diagnosed with gastroesophageal reflux disease and later he developed asthma. I want to know much on what is it, the asthma or the gastroesophageal reflux disease? Gold, please go to my YouTube channel. Doctor, please, I want us to chat privately. My brother, I'm sorry, I don't do private chat. Yeah, I don't do private chat. No vex. My brother or my sister, I don't know if you are a male or female. I don't do private chats on social media. What I mean is that I don't do inbox DM chats. I don't do it for professional reasons. I stopped it a long time ago. If not, everybody will be coming to my DM. So my DMs are closed. There's a link on my page. If you want to have a private session with me, click on the link and book for a consultation, and then we can discuss privately. But private chats, I know they do them. Yeah, my pages are so busy and so hot, so I can't respond to people anymore on that. Yeah. I'm just 36 years old, but I'm having gray hair. What can be the problem? Your age could be the problem. Your genetics could be the problem. Do you understand? It could be hereditary. It could be age related. It could be due to stress. You get right? Yeah. For those on YouTube, okay, I think we should end this YouTube live tonight. We have tried on YouTube session tonight. I appreciate every one of you who joined my YouTube live today. God bless you all for your massive support. Now, once more, I want to appeal to everybody listening to me on TikTok. We have about 52 people listening to me on TikTok. I beg you, I beg you. I have so many videos on my YouTube channel. These videos would help you a lot. Please, I beg you, I beg. Some of the questions you are asking me, I have already made a video on these questions. They are on my YouTube channel. Please go to YouTube, search for Dr. Fredosta on YouTube. Please watch the videos, subscribe, like the videos, comment. That way you are supporting what I do. You understand? So please, once again, I want to appreciate every one of you for your support thus far. I don't take this for granted at all. Thank you, thank you, thank you. So I'll be signing out from my YouTube live tonight, and I hope to have more sessions on my YouTube page as we go forward. Thank you, and I'll see you all later on YouTube. Remember, good life. Nonsense.